Hello, everyone, and thank you all for joining us during the Lytham Partners Investor Select Conference. My name is Adam Lowensteiner, Vice President of Lytham Partners. During this fireside chat, we welcome Reliq Health Technologies, ticker symbol of RHT, that is Robert Harry Thomas on the Toronto Venture Exchange, and RQHTF, that is Robert Quebec Harry Thomas Frank in the US, and its CEO, Dr. Lisa Crossley. Before we begin, for those not familiar, Lytham Partners is one of the country's leading investor relations firms. With more than 2 decades of corporate access experience, we have built one of the industry's most diverse and effective platforms for connecting small cap companies with high quality and focused institutional investors while creating a framework of best practices in all aspects of investor relations. Today's discussion is hopefully yet another example where we can bring value to multiple constituents. We will dive into the discussion in a moment, but one final item, I want to remind everyone that Reliq Health Technologies is available for one-on-one meetings. If you have not already signed up, please send me an email at lowensteiner@lythampartners.com or visit www.lythampartners.com/virtual and click the one-on-one meeting request button. With that said, let's begin. Hi, Lisa, and welcome.
Hi, Adam. Thanks for having us.
Sure. Our pleasure. Let's kick it off here with what are some of the key accomplishments that Reliq achieved in 2022 that you are proud of and are important to share with investors?
Yeah, well, I think for us, the most important priority in late 2021 and 2022 was establishing ourselves as the market leader in our space. So virtual care for chronic disease patients in particular. And so, we really were focused on what we've called the land grab or the real estate grab, which was acquiring as many customers and patients as we possibly could in as short a period of time as possible, and with the intent of really establishing ourselves as the standard of care for patients with chronic diseases who needed remote virtual care. And I think, my team did a really fantastic job of achieving that goal. And we announced many, many contracts, as you know, in 2022, including, some large ones, one with a network of physician practices in Florida that brings 50,000 new patients to the platform. And we've signed quite a few skilled nursing facilities. And I think we have about 174 skilled nursing facilities signed now in California and Florida. And of course, we continue to add more patients with individual physician practices and home health agencies. So, I think our goal for 2022 was very much to kind of cement our first mover advantage and clearly establish ourselves as the market leader in virtual care. And I think we accomplished that goal. And moving into 2023, we'll be shifting our focus a little bit more and sort of internally on operations around, onboarding and time to billability. But I think what we accomplished in 2022 is really impressive. I mean, we saw tremendous growth during that calendar year, and I think it set us up really, really well for the future.
So year to date, you've already announced some excellent wins. How should, as a reminder, I guess, how should investors think about patients being onboarded? Is it evenly per month, or is there a ramp towards later in the year? Meaning something signed today can take how long before all patients are onboarded?
Yeah, so usually we try to kind of spell that out in the press releases that, we'll say this number of patients will be onboarded by the end of the quarter, or it's going to take till the end of the year to onboard all of these patients. And investors should always think of it as a ramp as opposed to, an even number. So if we're adding 50,000 patients to the platform in a year, it's not going to be, 4,000 and change a month. It's going to be more back-end loaded, because the way that healthcare customers typically prefer to roll out software is they'll start with a small number of patients at a single facility, and then they'll expand if it's a multi-facility contract and into other facilities, and they'll add more patients at each individual facility, but that's kind of a gradual ramp up. So we sort of start small, prove out the business case to the client, which we've very successfully done in all of our deployments. And then the big numbers come sort of towards the end of the onboarding period that we specified in the press release.
So COVID is still out there along with some other viruses. Is there any seasonal pauses that you're seeing as a result of that? And is there a boomerang effect from this, whereby in order to prevent hospital surges in the future, systems like iUGO will help better manage patient flows? What are you experiencing there now?
Yeah, I mean, we aren't seeing as much of an impact from COVID as we did last year or late 2021, early 2022 with Omicron. And so that's a positive for sure. I mean, certainly this is a challenging time for hospitals right now with the triple demic of the flu plus RSV plus COVID. And that's not that I ever want to say something terrible like that. It's a good thing, but it certainly creates some positive market conditions for Reliq in that hospitals are very, very motivated to keep patients out of the hospital if at all possible. So a lot of these chronic disease patients are in hospital several times a year with what are considered preventable complications, like a flare-up of your COPD, congestive heart failure episode, there might be kidney issues, some issues around your diabetic control. So all of those issues with regular monitoring and patient engagement in their own care in the home can be avoided and keep those patients healthy and at home. And so that's really what hospitals are pressuring community physician practices to do is, find a way to keep your chronic disease patients healthier and at home, because once they're in the hospital, and not only are they taking up ICU beds typically because these are complex patients, but they're also much more likely to be exposed to things like COVID and RSV and influenza. And so they're more likely to spend a longer period in the hospital and to have more elaborate complications. So home is definitely the safest place for a chronic disease patient. And it's certainly the least expensive setting in healthcare. So it makes a lot of sense to try to keep those patients at home. And I think we're all seeing it, certainly in Canada. Hospitals are under tremendous pressure, and a lot of elective surgeries have been pushed back, and there's been a real strain on pediatric ICU capacity. So there's a lot of pressure coming from hospitals and from, the ministers of health in Canada in particular, and on the community physicians to try to do everything they can to keep these patients healthy and out of the hospital. And so I think that's where a lot of market pull for our platform comes in. And pardon me, I'm not actually sick. It's just a little irritated throat. But certainly we see there's a lot of pull from the community physician practices and home health agencies. And there's also that new significant pull from skilled nursing facilities, because what they're finding is that these patients are getting discharged home, and then they're not managing their condition, they're getting readmitted, and there just isn't room for them. So I think overall, the impact of COVID and RSV and flu has had a positive impact on Reliq's business. And although we certainly wouldn't wish a triple demic on anyone, it's something that I think has helped the healthcare sectors recognize the value of remote and virtual care.
Mm-hmm. Initially, you've been providing hardware for patients. Is that trend still continuing, or have more of the recent announcements have been software-only relationships? When will the software-only placements expected to dominate patients on the iUGA platform?
Yeah, so I don't think we'll ever have, many software-only contracts, but what we will see certainly is that software will dominate the revenue. So most of our revenue will come from software, but almost every deployment, the client is going to want us to procure the hardware for them. Yeah. And we do that because we're able to, with the 12 to 24-month payment plans, really get compelling margins on the hardware sales. So it makes good sense for us as a business to work with clients around procuring hardware. We've got great suppliers that we work with so that we can pay them on a sort of just-in-time basis. So as the clients pay us, then we pay the supplier. So we're not in the position of a typical hardware company where there's a huge amount of working capital tied up in inventory. Inventory is all held by the suppliers. It's drawn down as needed, and then we pay the suppliers on the same terms that our clients do over a 12 to 24-month period. So that's worked really well for the business, and it's given us some high margin revenue from hardware. And so that's kind of what you see coming in first from clients when we sign a contract, is the hardware revenue. But the software revenue is what is the continuously recurring, even beyond 24-month subscription revenue. And that is definitely still higher margin than hardware, even with the good margins we're getting on hardware on the payment plans. And I expect that by the end of this year, 80% of our revenue will come from software, and 20% or less from hardware.
Can you discuss the new markets you're developing for the iUGA? There's several that you've announced, CRO, clinical trials, hospice, pain management, and now recently skilled nursing facilities. How should investors look at each new vertical that gets added? I mean, what's the breakdown been so far Where do you see
Yeah.
getting most traction?
Yeah, I think the breakdown so far of our, existing active clients in terms of the number of patients who are onboarded and billable, and those are mostly from individual physician practices and home health agencies. But as we grow and as we continue to onboard some of these new clients, I think you're going to see a significant component of our business coming from the skilled nursing facility sector in particular. And that sector, is the one that's sort of the most interesting in terms of its dynamics right now. So skilled nursing facilities are under a lot of pressure from Medicare and Medicaid to reduce the length of stay for an individual patient. So where someone recovering from, let's say, hip replacement might stay typically for 3 weeks or 6 weeks, they're trying to shorten that to essentially half as much time. And so you have someone who's coming out of cardiopulmonary bypass surgery, who would have been in skilled nursing for a month, and they're going home after 2 weeks. Mm-hmm. That's a real challenge for the skilled nursing facilities because, pardon me, they are penalized if patients are readmitted within the first 30 days after discharge, whether the patient is readmitted to hospital or to the skilled nursing facility. So it's really important for them that those patients go home and stay healthy in the home. But when you reduce the length of stay, you significantly increase the risk of readmission. So they're in a very difficult position right now. And they have 6% of their total revenue from, Medicare and Medicaid at risk from these financial penalties. So, working with our platform, which we've shown very effectively reduces the rate of readmissions, but well over 80%. And they're able to avoid those financial penalties entirely, and it has a dramatic impact on their business model and their profits. So I think you'll see more and more of the skilled nursing facilities as part of our client base. And I think, overall, the different markets that we've gone after, the different segments, and really what we do is we respond to client needs. So when clients say, we've got a big pain management clinic that we want to onboard, and there's new billing codes around pain management or medication management, then, we'll get involved there. It's very easy for us having a very flexible platform to deploy a new module whenever there's demand. So, if a client comes to us and says there's this new billing code coming out, we want to be able to take advantage of it and help provide enhanced care to that segment of our patient population. Within a few weeks, we can roll out a new module that will allow that client to leverage those billing codes and allow those patients to receive really high quality remote care.
So back to the skilled nursing facilities, that could be a very large opportunity for Reliq, correct? And does it offer the same economics? And who's the primary physician for such patients? Is there someone in-house at these facilities? How does that work?
Yeah, so it's definitely a huge opportunity for us. I mean, we've got 164 facilities now, but I think that's just sort of the tip of the 74, sorry. And that's just the tip of the iceberg for us. And there's a large patient population that we're accessing through those skilled nursing facility contracts, and it's recurring. So essentially we get all of their discharged patients who have relevant chronic diseases. And so we get that, renewable resource, if you will, every month. And initially, the first month, we were charging $60 per patient per month, and that's for transitional care management, so care specifically for the first 30 days. And that's, really kind of a partnership between the skilled nursing facility and the community physician to kind of hand off that patient to the community and have their care be continuous and not just kind of drop off a cliff when they're discharged from the skilled nursing facility. After the first month, then the patient's on our standard platform, and RPM, chronic care management, behavioral health integration, whatever is relevant to their clinical conditions. And that's usually at about $65 per patient per month. So the economics are very good in the skilled nursing facility space. And the physicians really depends. So some skilled nursing facilities will have in-house physicians who will take the patients on after discharge. A lot of these patients don't have their own family doctor when they're admitted initially. So, we will work with the skilled nursing facility to find family doctors that are part of their community, and, the patient will be discharged under the care of that family doctor. So some of the patients will come in with their own family doctor, and then the skilled nursing facility will liaise with them to put transitional care management in place, and also the following months, the RPM, CCM, BHI, et cetera. But it's physicians that are in the community and have a relationship with the skilled nursing facility. And that's, that kind of ecosystem is very, very common, and particularly in the States, where there are, kind of hospitals and skilled nursing facilities and community physician practices who have those pre-existing relationships that they refer to one another. And they know that, if they send a patient to this hospital from a community physician practice or this skilled nursing facility, that, they're going to get the same level of care that the community physician, would be able to afford, or the same quality of care, rather.
Your announced contracts, they've been concentrated in certain states. Is that by design or demographic or better paying states?
Yeah, not by design. We did start our business by design in the southern US, in South Texas, where they have the highest concentration of chronic disease patients of anywhere in the US. But since then, really, we're sort of opportunistic. We go where the clients are. Florida, it turns out, to no one's surprise, has a huge population of retirees. So they have a very high Medicare patient population, and a lot of those Medicare patients have chronic diseases. So, it's a state where we have always expected there to be significant demand for our platform. And that's, certainly being borne out over the last 6 months with contracts we've announced. California is another big one for us. I think that's largely just due to the size of their population. And we have some unique opportunities in California and actually in Nevada, where we're working with specific cultural populations. So, people who want a platform that can deploy in languages besides English, Spanish, French. And that's something that our platform can do. We can certainly support, all different kinds of languages and cultures, and provide cultural specific content, as well as, the specific language translations. So we are getting a lot of traction in the southern states. I mean, obviously, Texas is still big for us. Nevada is coming online in a big way. The largest concentration of chronic disease patients in the US is in the South, and then to a lesser extent in kind of the middle of the country. So, we kind of go where the patients are. And that, to date has primarily been more in the South, although we do have contracts in Maryland, and we've got patients in Michigan and Ohio, and we're not restricted to the South, but that's definitely where you see the higher concentrations, and where you do tend to see more hospitals receiving the hospital readmission reduction program financial penalties, and skilled nursing facilities experiencing the same thing. So it's where there's the most pressing need, and certainly it's where there's a very, very large patient population.
Can you share any initial feedback from customers or patients that have been on the iUGO platform for a few months already?
Yeah, I mean, we've had some patients who've been on for, years now, and our typical expectation with patients is that they will be on for years, usually until, they die or enter hospice care. So they're on the platform for a long time. And we find that patients who, are properly trained and who become adherent, so they're collecting their readings as often as they're supposed to, get very excited about the platform, because they can see the impact it has on their health. They're not going into the hospital every 6 months, and they're not as breathless. They are feeling more energetic, and they're sleeping better. I mean, there's a dramatic impact on health just from having a patient engaged in their own care and really doing the things they're supposed to do on a daily basis, like taking their medication and checking their blood sugar or blood pressure. But I think one of the most compelling stories, and I've mentioned this in public before, just around Thanksgiving or sometime in November, we onboarded a patient who was discharged from a skilled nursing facility, and the medical director had said, I'm almost hesitant to put this patient on the platform because I'm just not sure he's going to make it through 30 days. So, I don't know if it's worth kind of, onboarding and all that. And given that this patient has, I think it was 9 different chronic diseases, including congestive heart failure, chronic obstructive pulmonary disease, kidney disease. I mean, really a very, very sick patient. And so, the medical director was saying, I just don't know what we can really do for him. But let's give it a try and we'll see. And the patient went home on the platform and did fantastically. I mean, really just tremendous improvements in health post-discharge, and very stable. So no need for a hospital admission or a skilled nursing facility readmission during that 30 days. And the patient continues to do well and to improve. So really, even the sickest patients, if you can engage them and you can tell them, you're not going home alone. You don't have to wait until you get really acutely ill again and then come back to skilled nursing or to the hospital and get, that high level of care. You're going to go home. We're going to be watching. We will notice if there are any issues. We'll be able to call you, change your medication. If we need you to come in, we'll be able to send an ambulance, but we're going to be keeping an eye on you. And that really encourages patients to become compliant and to, take more ownership over their own health. And it helps them also just with the reminders to take their medications on a regular basis and to track their key health metrics. And so these little interventions in the home really have a dramatic impact. We talk primarily about them having an impact on quality of life, an overall health outcome, but they have an impact on, survivability as well. So, for some of these patients, this is really a life or death change. And, for that particular patient, it was really inspiring for the medical director, for, our team to see the system have such a powerful impact on such a sick patient. So we get very positive feedback from physicians and from patients and home health agencies and all of that. And, I think we went out of our way to make sure that we designed a platform that's very accessible for patients in the home. So they don't have to learn how to use an app on a tablet or learn how to use the desktop. They don't have to have Wi-Fi in the home. We can do everything through the cellular network. And we've also, on the side that we don't talk about a lot, the side that's clinician facing, and our platform is extremely intuitive. It's very easy to use. It's very unlike most healthcare software. And so clinicians really do enjoy using it. It's just very intuitive. It just does what they need it to do, and they don't have to spend a lot of time on it. And that's really what the typical clinician is looking for, something that will support their existing workflows and not get in the way. They don't want to spend a lot of time learning how to use it. They don't want to have to, really think about it every time that they log in, try to remember how they're supposed to find such and such. They want something very intuitive and easy. And that's something that we worked really hard from the very beginning to develop for our clients. So I think, we get very, very positive feedback kind of across the board, which is wonderful.
How long has the average patient been on the iUGO platform? Or what is typically the tenure on the platform? I mean, I guess it depends on the application, but maybe you could walk us through such, such turnover. When a patient passes away, what happens to the hardware? Yeah. How does the next patient get signed up? Or how seamless of a process can it be?
Yeah. So typically patients are on for years. We haven't been around long enough to say that, it's 15 to 20 years, but, for patients who continue to do well on the platform, they will be on, for a decade or more. We do, as work with patients who are over 65 and typically over 75. So, they're not going to be on for 50 years, but 50 years, but they're on for the long term. Excuse me. Certainly, patients at that age and with those complex chronic diseases do pass away. So we see that every year about 8% of the 5% rather of the population will pass away, which is to be expected. But from the same clinician that we're losing 5% to death, and we're gaining 13% in new patients as the patients age into the programs or as new programs are introduced. So on average, we're seeing an 8% increase in the patient population from each of our existing clients every year. Excuse me. And in terms of the hardware, so if a patient is using hardware and they pass away, what happens is the hardware will go back to the clinician or it'll come back to us, either way. It's cleaned and then it can be redeployed. And so it's cleaned, with a very thorough sort of COVID type cleaning where it's really sanitized. But they can be redeployed. These devices were intended in the manufacturer to be used by multiple patients.
So can you share with the audience how early innings we really are with the iUGO platform and how the aging population will act as a major, tailwind for many, many years to come?
I mean, it's very early days for us. If you think about us and having several 100,000 patients on the platform by the end of this year, our target patient population, our total addressable market is over 57 million patients. So, we're talking about a very small percentage of our total addressable population being on the platform now, or even on the platform by the end of the year. So there's just tremendous room for growth. We're definitely in the early stages. We really kind of launched in 2021 in July, once things were starting to come back a little bit more towards normal with the pandemic. So we've been very focused on growth over the last year and a half, and I think that growth is only going to accelerate as we go forward. It's always tough when you're starting out and you have to kind of make a name for yourself in a new market. So I think we've done that work and we've done it very well. So I think that part of the hard work is behind us, not to say there's not, different hard work ahead of us, but I think, they talk about the valley of death, and with startup companies, really the hardest thing you do as a startup is going from sort of 0 to 1 million in revenue, and then 1 million to 10 million in revenue. And we've hit those two milestones, and we've established a reputation in the space. We've collected, several years now worth of clinical data that shows that our platform is very effective in reducing hospitalizations, improving health outcomes, and reducing healthcare costs. And we've got a couple of years of data showing that our clients consistently receive reimbursement from Medicare and Medicaid. So we're at a point now where we're able to attract those much larger clients who need to see that data. And so I think, you're going to see growth accelerate very significantly as a result, because we're going to be working with these larger and larger networks that bring more and more patients to the platform. But we definitely consider ourselves still in our infancy, and with the bulk of our growth ahead of us.
What should investors be on the lookout for in the coming quarters?
I think we've talked a little bit about on my last webinar, we're taking over responsibility for what we call adherence. So once a patient is added to the platform, there's a period where the patient has to get in the habit of collecting data at least 16 days out of every month. And we found that when we take ownership of that process, patients become adherent very quickly, and then their clinician is able to bill for them, and we're able to bill clinicians for those patients because we're able to provide the services. We can't technically provide a service unless the patient is adherent. And so I think, what we've learned with clients is that, when we leave that responsibility with the physician practice or the home health, and the adherence tends to come along much more slowly. So one of the big changes we've made for this year is, we're taking responsibility for that adherence piece. And I think over the next few quarters, we'll be reporting metrics that will really show how much faster patients are becoming adherent, and therefore how much more quickly they get to a point where, we can bill their provider for services delivered. So I think you'll see a big change from that perspective, going from having a certain number of billable patients, that percentage increasing significantly. We're also working with clients on collections, and that's picked up quite a bit, so that's nice. And certainly we expect, by the end of the fiscal year, so June 30th, 2023, that everyone will be current on their payables to us, or receivables be current, and so I think what investors should be watching for this year is, certainly those 2 points on the execution front, but also they should be watching for, that significant growth. We're seeing these larger skilled nursing facility networks come on board, and, there's some other sort of different areas of clinical practice where there are large clients that we're working on. So, I think investors will see a lot of growth from the company this year, and certainly they should, watch for those public disclosures, those press releases around new substantial contracts.
Is there anything else you want to say before we end the discussion?
I'll just say, because people always comment if I don't say it, even though I feel like it's sort of a standing comment. Our intent is to uplist to the NASDAQ later this year. Obviously, market conditions haven't been extremely favorable for healthcare companies in particular, over the last 9 months. But we do expect that whatever the market does, realistically, the company is well poised to achieve profitability and to show really significant growth. So I think we should definitely be in a good position to uplist later this year. So that's something folks can kind of keep their eyes on. And I'll also reiterate, because I know this is a question people ask frequently, no, we're not doing a raise. There is no raise on the horizon, and we expect to fund operations through revenues. So I think the company's in a great position, and this should be a very exciting year for us. Sorry about my voice.
That's okay. Lisa, thank you very much for your time today. We greatly appreciate it. To anyone out there that's not already signed up for a one-on-one, again, please send me an email at lowensteiner@lythampartners.com, or again, visit www.lythampartners.com/virtual and click the one-on-one meeting request button. We hope you all enjoy the conference. Have a great day. Thank you.
Thanks.